Okay, chapter 26. See if we can go through this a little bit faster. So we're responsible for understanding the role in preventing the transmission of infectious agents. We know that that's part of our job and the most important part of our job, along with caring for our patients and keeping them safe. Infection control practices are essential for providing a safe healthcare environment for not only ourselves, but for others that we are working with and with our patients. During the past several years, the number of healthcare-associated infections, or HAIs, has increased significantly, endangering everyone in the healthcare environment. So this chapter is going to talk about your basic aseptic technique, infection control measures, if I can speak, and then the necessary things that we need to do to protect our patients and the community from the spread of these harmful microorganisms. A disease state is caused by the infectious agent. Many microorganisms are contagious and can cause serious illness. We all know that. Nurses cannot be familiar with every microorganism there is out there, but they can prevent the spread of infection through aseptic interventions. The body has many defenses against microorganisms that can cause illness. The three main defenses are the normal flora, the inflammatory response, and the immune response. These benign microorganisms are found in and on the skin, eyes, nose, mouth, upper throat, lower urethra, small intestine, and large intestine. The normal flora constitutes the body's first line of defense against infection because it inhibits pathogenic microorganisms from colonizing into healthy organisms. The leukocytes release a chemical that increases the temperature in the area. The dilation, infiltration, and increase in temperature are protective mechanisms that help the body neutralize, control, and eliminate invading pathogens, preventing them from surviving and multiplying. If inflammation becomes systemic, signs include fever, which is caused by prostaglandins acting on the hypothalamus, chills, malaise, and altered mental status. Immune response is initiated by recognition of antigens. Antigens include protein molecules on the surface of pathogens and non-living substances, such as toxins, chemicals, drugs, and particles. Most people are born with innate or non-specific immunity. The adaptive mechanisms of direct or active and indirect or passive immunology, memory, determine how a person's immune system recognizes these antigens. The animation on the immune response provides more information. The innate nonspecific immune system provides immediate defense against foreign antigens. In addition to acting as a barrier to infectious agents, the innate immune system produces chemical mediators. It helps fight the infection, it helps remove the foreign substances, and it activates the adaptive immune system. The adaptive or acquired or specific component of the immune system provides long-term immunity when the body is exposed to the antigen. Humoral or antibody-mediated and cellular or cell-mediated immunity are two types of adaptive immunity. Humoral immunity is a defense system that involves white blood cells, or the B lymphocytes, that produce antibodies in response to the antigens or pathogens circulating in the lymph node and blood cells. Antibodies are immunoglobulin molecules that recognize foreign invaders. The antigen-antibody reaction initiates a complex chain of events to protect the body from the invading microorganisms. Humoral immunity enables production of inflammatory molecules such as interferon and interleukin-1, which causes fever. If a pathogen gets past that initial response, it is attacked by the adaptive immune system, which generates the antigen-specific antibodies and lymphocytes. Now, cellular immunity involves defense by white blood cells against any microorganisms that the body does not recognize as its own. So T lymphocytes, such as cytotoxic T cells, directly attack cells displaying non-self antigens or infected cells. Helper T cells release the interleukins and other substances that stimulate antibody production by B cells and antigen destruction by other cells, or macrophages. Immunologic memory. Adaptive immunity is antigen-specific and involves active long-term immunological memory. As B cells and T cells develop, they learn to differentiate between the body's tissues and substances that are not normally found in the body. Some cells are sensitized by interaction with specific antigen and become memory cells. Subsequent exposure to the antigen produces a stronger and faster immune response by these memory cells, which can ease or prevent later illness in many cases. Long-term active immunity can be artificially acquired by immunization with vaccines. Passive immunity occurs when a person receives an antibody produced in another body. Passive immunization provides immediate but short-term protection against antigens. Infants acquire passive immunity naturally in utero or through breast milk, and these antibodies disappear between the ages of 6 and 12 months. Passive immunity can be acquired artificially when antibodies are transferred from one person to another by injection of an antibody-rich serum or immune globulin. The skin, the respiratory, and the gastrointestinal systems have roles in fighting infection. Skin is a barrier that is impermeable to most infectious microorganisms. Any break in the skin can create a portal or entry or exit for pathogens. The skin contains squamous epithelial cells, which help to remove microorganisms and other infectious agents. Sweat decreases the likelihood of infection because its low pH inhibits bacterial growth. The respiratory system contains cilia and mucus, which move or trap foreign bodies and therefore decrease the risk for infection. The respiratory system is equipped with proteins that have antimicrobial properties and promote phagocytosis. The GI system's floral and low pH of the stomach prevent the colonization of pathogenic microorganisms by secreting toxic substances or competing with the microorganisms for nutrients needed to make it thrive. This is a diagram of the chain of infection. To understand how to prevent the spread of potentially harmful microorganisms, nurses must understand the chain of infection. The chain of infection has 6 main components: the infectious agent, the source of the infection, the portal or exit, the portal of exit, the mode of transmission, the portal of entry, and the susceptible host. Infectious agents are the first link of the chain of infection that is necessary to spread disease-causing microorganisms. Bacteria are single-celled organisms that live as normal flora on and in the skin, eyes, nose, mouth, upper throat, lower urethra, lower intestine, and large intestine. They are capable of causing disease in the human population when they overgrow as a result of immune system compromise or when they enter different areas of the body. Bacteria have different sizes, shapes, growth patterns, and means of replication, which is a term used to describe bacterial reproduction or duplication. They are named according to their shape and are classified by their ability to live with or without oxygen. That would be aerobic or anaerobic. And their staining qualities, gram-positive or gram-negative. Bacteria reproduce by dividing. One cell becomes 2 identical cells. Bacteria are identified when a sample taken from the body is cultured. An exact antibiotic sensitivity is tested so that the appropriate antibiotics are prescribed. Viruses are the smallest microorganisms. Viruses produce inside living cells of the host and are responsible for causing many different types of diseases. Illnesses range from the common cold to acquired immune deficiency syndrome or AIDS. Viruses cannot be killed by antibiotics. Certain antiviral medications are used to manage the symptoms of a viral infection. These medications, if given during the early phases of illness, can decrease the amount of time that the patient has viral symptoms. Fungi, like bacteria, are single-cell organisms that can cause infection. Molds and yeast are examples of common fungi. Fungi are present in the air, the soil, the water, and are responsible for conditions such as athlete's foot, ringworm, and yeast infections. Infections that are caused by fungi are treated with antifungal medications. Parasites are organisms that live on or in other organisms. Examples of these organisms include protozoa and arthropods, and another one that I'm not even going to try to say. Example, Parasites are typically transmitted by sexual contact, insects, and domestic animals. They cause many diseases in humans. Protozoa cause malaria, and now I'm going to have to say it, Helminths, Helminths, are responsible for intestinal worm infections, and arthropods are responsible for transmitting many skin and system diseases such as malaria. Inanimated objects include any contaminated surface or equipment, medications, air, food, water, on or in which a microorganism can find nourishment and survive. Human sources of infection are healthcare personnel, isn't that reassuring? Family, friends, and patients. Animals such as insects, rats, birds, pigs, cows spread disease and have been the reservoirs of many epidemics in the past, and for current diseases such as avian flu and mad cow disease, and the new one, Zirac, which is the new one being spread by mosquitoes. Always changing, always new. Infection spread requires portal of exit. Microorganisms escape through emesis, sputum, urine, stool, blood, genital secretions, and wound drainage. The microorganisms must have a way to travel from the source to the susceptible host. The form of transportation is referred to as the mode of transportation, or mode of transmission, Most microorganisms are transmitted by contact, which is the union or junction of body surfaces with the surfaces of other bodies or objects. Direct contact involves the physical transfer of the microorganism from the infected individual to the susceptible host. Indirect contact occurs when the microorganism is transferred by means of a contaminated object, such as a dressing, needle, or surgical instrument, such as a retractor or scalpel. Airborne transmission occurs when microorganisms are dispersed by air currents and inhaled or deposited on the skin of a susceptible host. Examples of illnesses transmitted through the air include tuberculosis, measles, and chickenpox. Droplet transmission occurs when the mucous membranes of the respiratory tract, such as your nose, your mouth, or the conjunctivitis of your eyes, are exposed to the secretions of the infected individual. Droplets cannot remain suspended in the air for long periods and seldom travel more than 3 feet from the source. Examples of illnesses transmitted by droplets are influenza and respiratory syncytial virus, or RSV, infection, which is common in newborns and young children. Airborne transmission and droplet transmission are often hard to differentiate. Microorganisms travel through the air in both cases, but the difference between the two modes is the size of the microorganism. Because smaller microorganisms can travel longer distances and can remain suspended for longer periods, they are considered to be transmissible by air. Larger microorganisms cannot travel long distances and usually require closer contact for transmission. They are considered to be transmissible by droplet. Vectors carry the pathogens from one host to another. Vectors often are invertebrate animals such as ticks, but they can also be vertebrate animals such as raccoons, which can transmit rabies by biting. Vector-borne diseases include Lyme disease, Rocky Mountain spotted fever, West Nile virus, and viral encephalitis. For the chain of infection to continue and the microorganisms to be successfully transmitted from a primary host to a susceptible host, there must be a portal of entry. There are many portals of entry. The gastrointestinal tract by ingestion, the genitourinary tract by contact with mucous membranes, the respiratory tract by inhalation, the skin by breaks in the skin, the urinary tract by introduction through the urethra. Individuals who are hospitalized are at increased risk for infection because of greater exposure to infectious agents and because many of the invasive procedures that are performed access the portals of entry. Standard precautions are used with all patients to limit direct exposure to blood and body fluids. Bodily discharges are disposed of immediately and properly to prevent spreading potentially harmful microorganisms. Hand washing destroys microorganisms so that others are not infected. Patients with contagious illnesses are isolated and personal protective equipment is used when entering the room so that a removable barrier is formed between the healthcare worker and the patient. These and other interventions practiced to break the chain of infection are discussed later. After the pathogen exits the reservoir, it must be transported to a susceptible host for the chain to be completed. Increased susceptibility is associated with people at the extremes of age, those who are nutritionally compromised, and those who have had recent trauma or surgery. Those who are immunocompromised because of chemotherapy, radiation treatments, long-term use of steroids, or transplantation have lower resistance to infections. Patients with chronic illnesses such as heart or lung disease, diabetes, liver or kidney disease, and human immunodeficiency virus or HIV infections or AIDS also have lower resistance to infections. HAIs or healthcare-associated infections cost $28.4 billion to $38.8 billion annually. Their impact includes delays in recovery, treatment, and discharge, longer hospital stays, permanent disability, increased costs associated with prescriptions, loss of earnings, disruption of family routine, anxiety, pain, and death, just to mention a few high points. Data about HAIs are collected by the CDC in an effort to improve the infection control methods used by healthcare providers. HAIs are associated with the use of medical devices such as catheters and ventilators, complications after surgical procedures, contagious transmission between patients and healthcare workers, and the overuse of antibiotics. HAIs may be caused by drug-resistant microorganisms such as methicillin-resistant Staphylococcus aureus, or MRSA, vancomycin-resistant staph, or vancomycin-resistant enterococci. So you have MRSA, VRSA, VRE, and bloodborne pathogens such as hepatitis. And of course, none of them can all be that simple as hepatitis. Microorganisms adapt to their environment to compete for survival. A microorganism is considered resistant if replication cannot be stopped by two or more antibiotics sequentially or simultaneously. Resistance is observed for community and health-acquired infections. Community-acquired microorganisms that have developed drug resistance include Salmonella, gonorrhea, Streptococcus pneumonia. Those are just to mention a few of the top. Microorganisms that have developed resistance in hospital setting include your MRSA, your VRSA, your VRE, and C. diff, or Clostridium difficile. Many factors contribute to resistance, including prescribing of antibiotics for non-bacterial infections, use of inappropriate antibiotics for the infecting microorganism, and incomplete courses of antibiotics. Infections are becoming increasingly hard to treat, and some microorganisms cannot be effectively destroyed by any known antibiotic. Until recently, new drugs have been provided in time to treat bacteria that had become resistant to older antibiotics. This is no longer the case because the cost of developing new antibiotics is astronomical, and the development of new antibiotics has slowed down. This is where education of making sure you teach your patients to take every one of their antibiotics until the prescription is gone is so important. Drug-resistant microorganisms pose one of the highest risk factors for the general hospital population and for all healthcare workers. And you need to make sure that you protect yourself, and that's why we have you wash your hands, and that's why we have you wear protective equipment. Several bloodborne pathogens can put patients and healthcare providers at risk for infection. They include hepatitis B virus, hepatitis C virus, and HIV. Exposure occurs through contact with contaminated blood and body fluids. Exposure does not necessarily mean disease development. Exposure and disease development can be decreased with the appropriate precautions and barriers. If exposure occurs, several steps can be taken to decrease the risk of developing the disease. These steps vary by individual institution or facility, but anyone who is exposed to a bloodborne pathogen should have baseline laboratory work completed to check for HIV and hepatitis. If the patient source is known, if you know the patient and you know their history, the patient then needs to be told about this, and they need to agree to be tested. Subsequent testing and medical prophylaxis may be warranted and needed at that time. Infections are classified as localized or systemic. The type and location of the infection determine the specific signs and symptoms observed during your assessment findings. Many factors can cause an individual to be more susceptible to infections. So your age has a factor in that. Your health itself has a factor in that. What you're already fighting, what infections you already have, if you've had compromised immune system, all of those different things. Cultural and ethical and religion factors into this as well, because of the ability to seek medical assistance or your belief in maybe the medical system itself. That can either hinder or help the treatment process. So those are just a few of the risk factors. During assessment, a history is obtained through not only interviewing but also through observation. A vigilant nursing assessment considers the patient's susceptibility and clinical appearance and the effectiveness of the patient's defenses against disease. The nurse observes the patient general appearance to detect infection. Specific questions can help to determine whether a patient already has or is at risk for an infection. So if you notice that their lymph nodes are swollen, or did they get immunizations as a child? Do they feel short of breath? Are they eating okay? Those things. Infections are classified as acute or chronic. Acute infections develop and run their course rapidly. Examples of acute infections are coughs, colds, ear infections that last 10 to 14 days. Chronic infections such as infectious mononucleosis may persist for months, as may wound and bone infections. Infectious diseases such as hepatitis and AIDS can last for years. Some patients with an infectious disease may have no visible symptoms at presentation, whereas others can have a varied clinical picture depending on the specific infection. Signs and symptoms of infection that may be observed are fever, chills, malaise, altered mental status, headache, and fatigue. Confusion is common presentation in the elderly and is often the first indication of an infection, such as pneumonia or urinary tract infection. Altered vital signs can indicate an infection. Temperature elevates slightly as the infection process begins. This is the one way the body's defense mechanism warns you. As time passes and no interventions are initiated, the temperature continues to increase and other symptoms occur. As the infection continues, the blood pressure rises, pulse and respiratory rates increase. Some patients with severe infections, such as sepsis, may have damage to the body organs and may become hypothermic. Decreased blood pressure is a late sign of infection, indicating septicemia and shock. I'm going to say that all again. Decreased blood pressure is a late sign of infection, indicating septicemia and shock. Adequate nutrition is important in the body's defense against infection. Infection depletes proteins, vitamins, minerals, and water in the body. And since our body is mostly made of water, that's a good thing to remember. These nutrients must be replaced to ensure adequate functioning of the body's defense mechanisms. During the physical assessment, the nurse assesses the patient's skin, mucous membranes, and overall appearance, in addition to asking the patient about how they eat, if they're hungry, when do they drink a lot of water. Nurses must be aware of the many conditions that place patients at increased risk for infection. Chronic diseases, alterations in the immune system, medications such as chemotherapeutic drugs, alterations in skin integrity, malnutrition, indwelling medical devices such as urinary catheters, lack of proper immunizations. Other conditions can cause a patient to develop an infectious disease when exposed to certain microorganisms. During the physical assessment, the nurse assesses the patient's skin and dietary intake and the integrity of invasive catheters to detect any subtle signs of infection. If you see drainage or discharge or anything like that, good chance they're going to have an infection. Tests include a complete blood count, or CBC, and a differential white blood count cell count, WBC. The normal WBC, or white blood cell, for adults is 4,500 to 10,500 cells per millimeter times 3. Trust me, you're not going to have to know these. Not for my class. Maybe for med-surg. But you're not going to have to remember these levels for right now. Just know that that's something you look at. The differential white blood cell count is the proportion of each type of white blood cell in the sample of 100 white blood cells. It helps to determine whether the blood is mounting an immune response to infection. A shift to the left, relative increase in immature forms of blood cells with a higher percentage of neutrophils than normal indicates an infection. This is done in the laboratory. You're not doing it. You're looking for the result, but you're not running the test. Culture and sensitivity testing of the blood, urine, stool, or wound drainage may be indicated. Culture of a specimen determines which microorganism is causing an infection, and sensitivity testing determines which antibiotics, if any, can be used to treat the infection. The ESR measures the degree of inflammation in the body, and the result can be an indicator of infection. An ESR, or a WSR, depending on what lab you use or what doctor's ordering, remains elevated, indicating a poor response to current therapy, whereas an ESR that decreases indicates good response. An ESR test is performed by timing how fast red blood cells settle to the bottom of a tube of whole blood. They settle faster when inflammation is present. Nursing diagnoses are developed on the basis of objective and subjective patient data collected by the nurse. Nursing diagnoses clearly identify patient problems for which a nursing intervention is required, and nursing care plans are developed. So here are some of them that you would probably come up with for a patient that possibly has an infection. Reviewing data collected during your assessment helps you be able to set realistic outcome criteria and helps you be able to identify patients' capabilities of following these interventions and goals for what you have set up with him or her. Collaboration with patients and families and with members of the health team is imperative to identify desired patient outcomes and set mutual acceptable goals. Goals are directed at alleviating the specific problems identified in your nursing diagnoses. So some of your goals could be patient's incision will remain infection-free during hospitalization, or patient will maintain good personal hygiene by the end of day 3 after admission. The nurse plays an important role in infection control. The nurse must be proficient in aseptic technique to reduce the hospital's risk, The nurse must be proficient in aseptic technique to reduce the patient's risk for a hospital-associated infection. All nursing practice should be guided by research. Keeping abreast of these things can be challenging to the nurse who is busy with day-to-day clinical practice. Evidence-based practices can be found in the following websites: your CDC, the Nursing Guideline Clearinghouse, National Institute for Health. They're all listed here. Diligence in performing these interventions decreases the likelihood of spreading infections from one patient to another in the healthcare facility. Hand hygiene is your most important thing you can do using soap and water. The use of alcohol-based sanitizer or use of surgical hand scrub is also available. And the only thing I would strongly suggest you do is if you use the antiseptic sanitizer frequently, periodically just go and soap and water your hands really, really good. Just my thought. It's one of the most important acts that a nurse can perform to protect the patient, self, and other patients from the spread of infection. Hand hygiene breaks the chain of infection by interrupting the mode of transmission. A surgical hand scrub must be performed before all surgical procedures and before other procedures as necessary. This type of hand hygiene is performed with an antiseptic agent. A disposable sponge is used to scrub the hands, fingers, and wrist to reduce the number of microorganisms on the intact skin. Precautions and isolation. Use of standard, airborne, droplet, and contact precautions reduces the transmission of pathogens. Standard precautions are used with every single patient. They are the practices that prevent the spread of infection disease by minimizing the risk of transmission or exposure. Because it is not possible to identify patients who may or may not be infectious at any given time, the nurse practices standard precautions in dealing with every patient to protect other patients, visitors, and staff and themselves from exposures. Patients who are immunocompromised, where they have a neutrophil count less than 500, may be placed in protective isolation. This type of isolation protects susceptible patients who may not be able to fight infection from microorganisms in the environment. Patients who are undergoing chemotherapy, irradiation, or bone marrow transplantation, and patients with severe burns may be placed in this kind of protective isolation. Transmission precautions. You have airborne, droplet, contact are used in addition to standard precautions to decrease the transfer of highly transmissible pathogens. Each transmission-based precaution requires the use of specific PPE to prevent the spread of communicable diseases or illnesses. Patients and their families can become partners in preventing the spread of infectious illnesses. It is important to educate them on how they can play a role in reducing the spread of this illness. The nurse creates a culture of safety when standard and transmission-based precautions are followed and when education is provided to patients, families, and healthcare team about the hazards of not following specific precautions. This has become quite a big topic for us in the hospital setting, because we get a lot of patients that are admitted that have MRSA or have VRSA or VRE, and family members who live with them 24/7 don't ever have to wear protective garb when they're with them at home, but when they come into the hospital, now they have to dress up in these funny precautions. And so education is a huge, huge thing for you as their nurse to help the families understand why now they have to wear this. So the next couple of slides just go over some of your basic ways of how you do your skills, and I'd like you just to look at those and make sure that you are aware of that and be able to demonstrate for us. Standard precautions themselves do not require documentation, so you don't have to write in the chart, I use standard precautions with every patient. Respiratory etiquette is part of the standard precautions. That includes covering your mouth and nose with a tissue when sneezing or coughing, and then disposing of the tissue immediately, washing your hands promptly thereafter with soap and water, or if you need to wear a mask if you're going into a patient's room and you're sneezing quite a bit. Really, you shouldn't be there if you're that infected, but that's just part of what happens. Just remember that those droplets can carry 3 feet from where you are at to another person. So these simple steps have reduced the transmission of many organisms and have prevented infections in the healthcare facilities greatly since they've been instituted. We're going to talk about a Safe Practice Act real quick, and it's an alert that you should always remember that you do not ever recap a dirty needle or a used needle, because the risk of exposing yourself to a needle stick is great. So do not ever recap needles. We'll go through that a little bit more when we start using them. Nursing care guidelines here. Please look at this and just know it's going to go through some of the different isolations that are needed for the different type of precautions available. Transmission of a contagious disease may occur through several routes. The following are typical diseases and conditions requiring use of contact precautions. So contact means you're going to need to have gloves on and people, contact. They either touch you or you touch a piece of equipment that they touched. Okay, so multiple drug-resistant organisms, MDROs, including your vancomycin resistant, your methicillin resistant Staph aureus, your Clostridium difficile, and the RSV virus and the hepatitis A virus. Scabies, herpes simplex or HSV, and any draining wounds in which certain organisms have been cultured. So any wounds that have drainage that are coming out of them, that's a source of transmission of organisms. Airborne precautions are used when known or suspected contagious diseases can be transmitted by means of small droplets or particles that remain suspended in the air for prolonged periods. Small droplets or particles can cause disease transmission over a greater distance and longer time than larger droplets. or suspected contagious diseases can be transmitted through large droplets suspended in the air. Droplets may be generated when an infected patient coughs, sneezes, or talks. Droplets may be produced during medical procedures such as suctioning, endotracheal intubation, cardiopulmonary resuscitation or CPR, or chest physiotherapy where you're doing percussion on their chest to help loosen the secretions in their lungs. Protective isolation varies according to the reason that the patient's immune system is compromised, and a variety of protective precautions may be used. A positive pressure room with a HEPA filtration system may be required. A mask is required for anyone entering the room or for the patient if the patient is leaving the room. Meticulous hand washing is essential. The patient must be assessed carefully for signs and symptoms of infection, and no live plants, fresh flowers, fresh raw fruit or vegetables, sushi, or blue cheese may be brought into the room because they may harbor bacteria or fungi. All right, but you never thought about blue cheese now, did you? So just so you know, people, if you have anybody that's in that kind of isolation in your clinical setting, you probably will not be assigned to that patient, not because we don't think you'll take the precautions you need, but the masks are specially fit so that they are a little bit more secure to the staff members, and it is hospital policy that only employed staff will take care of them. Okay, so that was pretty easy. Documentation, of course, if you are in a room that is using specific isolation, you will document that you use it. You will say that it's in place and it is being used. The door will have a special sign on it. We'll go through those signs in lab today and probably in demonstration, and we will go over the isolation procedures. Standard precautions are pretty basic. It's just your hand washing, covering your mouth when you sneeze or cough, and then vaccinations. Transmission based, again, it depends on what the microorganism is that we're dealing with. We'll go over this in our discussion. Personal protective equipment is the equipment that the healthcare personnel will wear anytime that they think that they need to protect themselves from spreading infection. It includes gloves, masks, goggles, face shields, gowns, caps, shoe covers, and those are just some of the examples. Sterile gloves are needed during sterile procedures only, such as inserting the catheters, doing any kind of sterile procedure on the patient. Gloves decrease the risk of transferring organisms from one individual to another. Gloves are changed if they become soiled and are always changed between patients. And then remember that the proper use of your PPE is essential to stop the spread of microorganisms. That's the whole purpose behind it. It's not so we can play dress up and look like little rubber ducks walking down the street in yellow outfits. It's actually, there's a purpose. Okay, so there's a little skills check here for sterile gloves. We're just going to skim on by that. Again, masks are used to not only protect you from breathing in the organism, but protect your patient from if you have anything that might be transmitted to them. Special respirators such as the N95 masks, those are used for droplet precaution patients. They're thicker, they don't transmit as well, or they don't allow organisms to transmit as well. And so, like I said, you probably will not be using those due to the fact that the facilities train those, or special fit those for their staff. Blah. Waterproof gowns are used when there's a possibility that the healthcare provider's clothes will become really soiled. So you have a patient in isolation, they have a code brown, and you need to go in and clean them up. So you want to use a waterproof gown because you want to be able to protect your own clothing and yourself from anything that might absorb into it. Aren't you excited to be a nurse? All right, skills for protective. We'll look at this when we're together. Moving on into, not only do nurses use the protective gear, but anybody and everybody that goes into that room. Lab people, respiratory therapists, physical therapists, dietitians, anybody. They have to use it too. So it's not just being picked on the nurses. Everyone gets to do it. And if they're not following the precautions and they're not doing that, then you need to very gently pull them aside and remind them the importance of using the protective gear that is out there for them as well. All right, here's the evidence-based practice as to why we put the protective equipment on. Please look that over. There are certain steps that we use in putting the gowns on and taking them off, and we'll go through that when we're all together. Immunizations provide the vaccination protection for the individual against the particular communicable disease. Although vaccine-preventable diseases are at an all-time low, there's still an issue with under-immunized children, adolescents, and adults. It's called herd immunity, HERD immunity. We've seen a lot more outbreak of whooping cough. We've seen chickenpox. We've seen measles. We have a lot of people that feel that vaccinations are not good to give your children. They strongly oppose them and do not feel that it is beneficial for their children. That's definitely our patient and our community people's right to have those opinions. I hope that I can educate people to know why the importance is there. It still is their choice to immunize, and that's okay. But as nurses, we need to educate and give as much knowledge to them as we possibly can. If we are the ones that have this belief, please know that that's okay. That's your right. That's your choice. Please educate yourself and make sure you have all the appropriate good and bad information about vaccinations so that you are making the most educated choice that you can, not only for yourself, but for your children and for your family and neighbors. Okay, medical asepsis and surgical asepsis are techniques used to prevent infection or to break the chain of infection. Please look at the two differences here and just know the differences between the medical and the surgical. Sterile fields. The purpose of a sterile field is to help stop the spread of microorganisms. It's also to provide an area for sterile equipment to reside while you are doing a procedure. We will show you how to do this in the most appropriate way. And please know that as we do certain things, if you have questions, please ask us. We will stop and hopefully be able to answer them correctly for you. All right, disinfection and sterilization are used to remove potentially harmful microorganisms and to eliminate microorganisms as the potential sources of infection. Germicidal agents are used to disinfect objects. Antiseptic agents are used to disinfect skin. Please know the difference. When you go to grab one of the wipes off of the top of an isolation cart, or when you go to get something to clean a certain item off. Say you took a thermometer into a room and now you want to clean it off. Make sure you use the right cleanser, the correct wipe to use with that. And make sure that you're using gloves whenever you use those, because your hands do absorb that antiseptic, or they absorb that germicidal into your pores, and eventually it can start hurting your own system if you absorb too much over a long period of time being a nurse and using those wipes. That's just my little spiel for the wipes. Make sure you're using gloves at all times. Make sure you're using the correct agent to clean the stuff you're cleaning. Examples of chemical disinfectants include alcohol and the chlorhexidine. The nurse should always check the expiration on the package before use. If the date of the package has expired, the contents are no longer considered sterile. Physical sterilization occurs through steam, boiling water, dry heat, or radiation. Chemical sterilization occurs through the use of gases, such as ethylene oxide gas or solutions. In our clinical or in our practice skills in the lab on campus, you're going to see a lot of outdated stuff. And that's because we get donations. We don't get the perk of having current updated fluid, current updated tools. We get hand-me-downs and expired things. So just know when you are out practicing, you are going to be looking. We are going to ask you to please look at expiration dates in the practice settings, just know that if it is expired, let me know that. That's fine that you realize that. We're still going to use it. In the real world, when we're out there doing, if it were expired, you would not. So you need to make sure that you're not only doing it yourself, but you need to teach family and you need to teach your patient the proper technique of hand hygiene before they handle any food, before they eat, after they use the toilet, before and after any kind of dressing changes are done at home, before or after they even, think about doing anything to an area that isn't open skin. Make sure all people who are involved in the care of that patient are going to be taught that. Instruct the patient and family not to share personal items like toothbrushes, washcloths, towels, especially if you have someone who has an open wound that is being cleansed and you've got, they're washing their leg around that wound with a washcloth. Don't let that washcloth then be used on somebody's face. Think about those things. Have them use hot water when they're washing towels and washcloths. Make sure they are cleansing and have those things available. Instruct about cleaning the reusable equipment and supplies, how to use soap and water, how to use disinfectants, how to use chlorine bleach. Teach the patient and family members the signs and symptoms of what an infection would look like and how to avoid that, and when to contact their care provider. Remind them about avoiding coughing, sneezing, or breathing directly on others and cover their mouth and nose to prevent the transmission of airborne microorganisms during this infected period. Emphasize the need for proper immunizations of all family members, and then you need to make sure that you're teaching them the correct and proper way of disposing of the contaminated dressings or any kind of disposable fluid or anything that you are using on that contaminated area. You want to make sure that they are disposing of it correctly so it's not going to contaminate anyone else. If you are teaching them how to do self-injections, which will be down the road for all of us in just a little bit, make sure that they are aware of how to dispose of those needles and that they have a device or equipment provided for them and that they know where to place that afterwards when it's all full or they are done with it. Evaluation, we're at the end of this. It's an ongoing process. You evaluate the minute you start teaching. You evaluate how that teaching is going. You evaluate how the patient, the family, and all involved in their care are receiving that information and have them start demonstrating to you immediately upon admission to the facility that you're at how they would do these things when they go home. Because, as you know, I've said this before, discharge starts upon admission. And it's very important that we start teaching immediately with our patients because we don't have a heck of a lot of time with them anymore. And we need to be able to start teaching them and have them have all of the knowledge that we need them to have so that they can be successful at home. See you in the next chapter.